Hi everyone, my name is Priya, and joining me today is Chetan Parikh, serial entrepreneur and healthcare AI visionary. Chetan, thank you so much for joining me today, and why don't you take a second to introduce yourself to us?
Sure. Thank you so much, Priya, for inviting me. Uh, I have been an entrepreneur for more than 20 years. Started my journey with a medical transcription company. Me and my best buddy started it, just two of us. At one point, we grew it to more than 2,000 people. But what most important thing I realized is there was so much of wealth of information in the transcribed reports that was being underutilized. And so in 2009, I decided to start looking into technologies to understand that and really give value back to my providers. So did a lot of work developing NLP from scratch using clinical data, real data, and started a company by the name of 𝐅𝐸𝐷I, which was into computer assisted coding using NLP. Grew that company and then sold it in 2021. But I was not done. I had to keep on going, so started RAAPID, and here we are today.
So, you've been in healthcare for more than 20 years and on the front lines of some watershed moments in healthcare AI. Before we even dive into the healthcare AI part of it, can you share with us some of your key learnings across your journey?
Yes, I think if I really take a step back and think about it, at the heart of healthcare are only three entities or three pillars on which this healthcare is balanced: payer, provider, and patient. It's the trinity. But when I look at it and look at the situation of these three players today, none of them are happy. It's kind of, if you look at the patient, and you and I both have been patients, we see that we don't get appointments on time. Even when we go to the doctor is typically focused on the computer rather than us. And I don't think, as I'm getting older now, I don't think the doctor is really looking into all of my chronic conditions. They look at my acute conditions. And so I leave the doctor's office feeling a bit dissatisfied. Now, having worked for providers for so long, I have also realized that the providers are not happy because they went to medical school and spent a significant portion of their life, early life, in getting trained to treat patients. However, what are they doing now? They are burdened with important administrative jobs. They have to enter so much information in the computer, complete so much paperwork that they really are burnt out. They are not happy that they are not able to pay attention to their patients. And then the payers, who are essentially responsible to collect the money, distribute the money to the needy, essentially, and pay for the healthcare, are unhappy because they are clueless now that what is the real cost of patient care? How much is it going to cost them? Their actuarials are unable to come up with those numbers. And so they are on a double edged sword. If they make more money, people are going to say they are hogging money. But in reality, if they are not careful, they can go bankrupt. So all three parties, it's just the three parties, and all three are unhappy. It seems that healthcare is not healthy right now.
What an incredible irony. So, how do we make healthcare healthy again?
It's these are the best times, and every entity, whether it's the government, private sector, individuals, everybody's focused on doing just that. But in my eyes, I think since healthcare is a highly regulated industry, it is very important that a push really comes from the government, and it is happening. So the older models were based on fee for service, and now the government is pushing. There have been talks about value based care, but the government is really pushing to implement value based care. So that is excellent thing. That is one of the ways in which we can make healthcare healthy again. Now, if you look at a more micro level, I think if the physician or the provider had the right information about the patient they are seeing at their fingertips, which essentially allowed the provider to understand what are the chronic conditions, what has been the history of the patient, what treatments are going on, how is the patient responding. If the provider had that synoptic important information at his or her fingertips, they would do a bang job because they are well trained, they are smart people. They just lack the information and time. But with the right information, they can utilize the time to give great service to the patient, keep the patient healthy. Now, if you do that, the patient is going to be very happy because as a patient, I want to make sure my doctor is looking in my best interest and not missing anything. And once that is done, after the visit, when the provider documents that visit, it's going to be very accurate. All the disease are going to be captured accurately. So the provider is happy, the patient is happy. Based on the documentation, the claims that get generated and sent over to the payer is going to be happy because they don't have to worry about it. They know it's accurate. Now, based on that, they can do the actuarial analysis and figure out how much it's going to really cost to treat that patient. So they have a better handle on and control over the patient's cost of care. So we can make all the people happy just by doing one thing, providing the right information to the provider, to the physician at the point of care. That is, in my opinion, that will change the game.
So it's a simple but insightful vision. And on a side note, you mentioned that the US healthcare system is moving from fee-for-service to value-based care. Can you shed a little bit more light on what that is and what the difference between the two are?
Sure. So physicians typically get paid when they see a patient. When they see a patient, they have to spend a certain amount of time, certain amount of their expertise and education to understand what's going on with the patient. And then they do procedures or they act on that information. Maybe they give an injection, they check the patient's vital systems, they might do a surgery, whatever it is. But the physicians would be billing the insurance company on the procedures and what they did. That is fee for service. Now, if you look at it, Priya, here the physician is focused on making sure that they are looking at the patient's current illness and the symptoms and taking care of that. And they are getting paid. But there is no indication that they are proactively looking at the other chronic conditions which have not flared up yet. But are they under control or not? Like diabetes, what's going on with it? Hypertension, all of these are chronic long-term disease, and the patient may not be complaining. Does not mean that it's not there. So the fee for service is not allowing the providers to take a deeper dive into the holistic care of a patient, right? Value-based care, on the other end, is now saying that, acute conditions are important. You need to take care of it. If I have a broken arm, you have to take care of it. But value-based care says that put a lot of emphasis on the patient's chronic condition. And if you look at the US population, it is increasing, right? The average age is increasing. People are getting more people are older, getting to retirement age. And as people get older, the number of chronic diseases, the comorbidities, the complexities all increase. And when that increases, the cost of care increases, right? So with value-based care, if you can proactively take care of all these complications, the comorbidities, as well as the chronic disease, you can keep the patient as healthy as possible. And at the same time, you can ensure that the cost is contained, right? So value-based care is a beautiful program. I believe that's the right way to do it. Now, one word or one term which we did not bring up is risk adjustment, because it'll come up. That's what we do. So in my thinking, risk adjustment is the core of value-based care. Risk adjustment means individually for each patient, understanding what are the chronic disease, what is the provider doing to manage those conditions, and how it overall affects the risk score of a patient. In healthcare, it is very important that we understand when people talk about population health or fee for service, they talk about averages, that the average population is this, the average cost is this. But no, in my eyes, healthcare is always very, very, very personal, individualized. We need to make sure that we understand the risk profile, the risk score, the chronic condition profile, as well as the treatment remedies that is going on for individuals. And that is what is risk adjustment in my eyes.
Amazing. And thank you for that elaboration as well. To get back on track, you did have a very successful exit with 𝐅𝐸DI not too long ago, your previous company. But what inspired you to keep going in this space?
I was very certain when I exited 𝐅𝐸DI that the future is bright for value-based care. It was written on the wall. Things had already started moving. And I see value-based care as a holistic approach of managing health and not sickness, because you are now proactively looking at the chronic conditions of the patient and making sure that the right interventions are happening at the right time so the patient stays as healthy as possible. More importantly, the disease does not flare up very quickly and the patient has to run to ER. Even if it's a planned, there's a surgery to be done, it is planned. It's not urgency, because the cost of doing it in urgency and the life risk to the patient is very high, right? So I was very excited about value-based care. We had a lot of experience dealing with clinical data, healthcare data, codifying it, because my previous company, 𝐅𝐸DI, was in computer-assisted coding. But we had not looked at it from the value-based care angle. And when I exited, I saw that this massive amount of data that needs to be analyzed with high fidelity and precision was humanly very difficult, if not impossible. And there's so much subjectivity with different coders doing it. And AI was at a point where it could do it now. And so I said, this is the time to jump into it. And so as soon as I got out of 𝐅𝐸DI, put a team together with amazing people and wanted to solve this problem, disrupt the risk adjustment space completely. So that is why I got into it.
That's amazing. And I love what you said about how healthcare is not about averages, but it's about individualized care.
True.
A lot of healthcare companies today are beginning to catch the AI wave, and it's quickly become a crowded marketplace. So how do you find that RAAPID has differentiated itself in this space?
Very, very good question. And when I talk with a lot of prospects and customers, there's a lot of confusion. There's a lot of noise. And to separate signal from the noise is very difficult for the customer. So when I talk with the CIO or the CMO or the VP of population health of large institutes, maybe a provider, payer, they say, how are you different? Because they are confused. And everybody uses the same terminology. We are an AI company. We leverage large language models. We know generative AI like no tomorrow. We use NLP. Our accuracy is the best. So how do you separate it out? I think the proof is always in the pudding. But in case of RAAPID, our team is made up of scientists who have done it and who have created NLP and technologies for computer-assisted coding in healthcare since 2010. I started in 2009, so I have the same team that I started with. Lot of experience. So we had that experience was very important that we carried forward in RAAPID. The other thing, what I realized is AI in healthcare cannot be general purpose. Just like we talked about, each patient is individual, each use case is very unique. And so we purpose-built our AI. There's a new term which is coming out, which you'll hear or may have heard, neurosymbolic AI. So NLP is a good solution, but it is still not accurate, and it takes a long time to really improve its accuracy, a lot of data. Large language models hallucinate, and explainability is also questionable. How do you bridge the gap and make sure your AI is as accurate as it can be, and it should not hallucinate? That's not allowed. This is healthcare. So when you take large language models and then infuse large knowledge graphs, you now stop hallucination and you make it very explainable. And that is what we are doing. Our technology is leveraging the latest and greatest in AI to ensure that our output is highly accurate and is explainable. Two things, and it's not a black box. We are also removing all biases. Bias has been a big thing that has plagued healthcare AI.
Mm-hmm.
So we have taken care of that. In layman's term, I would say that our AI thinks like a doctor, understands like a doctor. It really understands what is going on with the patient, what are the workflows that a typical physician would do when it sees certain lab numbers, certain medications, certain symptoms. So it thinks like that. So it can help the doc to see the data from a doctor's perspective. From a document perspective, it thinks like the world's best medical coder. It can understand different terminology and correlate it with the right, accurate medical code, whether it's ICD-10-CM, CPT, PCS, whatever it is. Then, if there are gaps in documentation or there are gaps in giving care to the patient, care gaps, it thinks like a CDI, clinical documentation improvement specialist, so that it understands here are the gaps, and based on that, it can recommend to the doctor that, hey, can you please shore this gap? And finally, it also thinks like a CMS or a RADV auditor to make sure everything is in compliance. So you can think about all these users of our system, doctors, coders, CDI specialists, and auditors at the top of their game. And then we are giving the output to the human to curate it or validate it. Mm-hmm. So that is a huge difference that I see that we are making in the industry.
That's awesome. It's clear that you've leveraged your years of experience and expertise in this space to build an AI like it's on steroids.
Oh, thank you so much.
And being in this space, I know it can be exciting, but also a little bit anxiety-inducing for industries to introduce a new technology, particularly in healthcare.
Yes.
And the best solutions from my research do a few crucial things, from reducing costs and improving revenue, reducing the burden of administrative tasks on providers, and also redefining the standards of care, all while staying compliant.
True, very true.
So how does RAAPID deliver on all of these KPIs?
That's a very, very important question, and that is what our customers expect from us. As if you look at the market, customers are not, it's a highly regulated industry. And so customers do not put their trust without really evaluating a new vendor. You use the word, AI on steroids. I think that is what Gen AI is. It's going to blow the not only healthcare, it's going to disrupt all industries. But to solve each use case, we are not at the point, and I don't foresee that we'll be at a point that quickly where one AI can do it. You'll still have to purpose build it. There'll be a narrow focus on that. And that is what we are doing at RAAPID. To give you an idea, all these KPIs make more money, improve revenues, become more efficient, higher productivity so you can save more. Make sure that you are taking the burden away from the physician and the providers and the clinicians, while ensuring that as new information and new models are developed, they are replacing the older ones. So giving the best possible care to the patient. And while, as you said, being compliant as possible. Now, if you look at the market that we serve, I'll give you an example on the payer side. We serve two markets. We serve the payer and the provider side. On the payer side, our solution is known as retrospective chart review or retrospective audit solution, where essentially every health plan or a payer needs to submit what is known as HCC codes and RAF score, risk adjustment factors, for each patient to CMS, because that is how CMS will reimburse the payer. Now, when the payers get the claims from the providers, it has all the codes, they cannot submit it directly. The reason is they are unsure whether those codes are accurate or not. And for that reason, they would hire companies who have large teams of coders to review the charts, or they would hire a technology company like us to semi-automate some of that tasks. I'll give you one example of one of my customers, a small to mid-size health plan with about 100,000 patients' lives. It used to take them about 8 to 12 weeks to complete the work. With our solution, they were able to do it in 2 weeks. So productivity gain. Even after doing it, they would have to have a QA and a second and a third pass to look at the accuracy. Our out-of-the-box accuracy was north of 80%, and submitted scores was north of 98% accurate.
Wow.
So they were not worried. They did not have to go through multiple passes. Very important. We were able to identify several cases where we believed that there was not enough evidence that was documented to support a claim or a code. And so we had them delete those codes and make sure they were in compliance. And at the same time, we were able to find a number of codes which the physician had not documented, but not coded.
Okay.
And that gave them an improvement in revenue of about $3 million.
Wow.
So now you can see we were taking care of all the KPIs in one technology platform.
Wow.
So yes, it is possible. And I strongly believe a strong purpose-built AI is necessary to do that.
Absolutely. And I think you were very comprehensive, and thank you for giving me a good idea of the solutions for the payer side of things. How about the provider side of it all?
Right. So we also have a solution, but by the way, it's all on a single platform. So you can imagine a single platform where it's single, data set and models, but providing solutions to the payer and the provider. The provider side solution is known as prospective solution. And within that, one is known as a pre-visit. And that is where the excitement is. What I believe is if we can get, and we are doing it today, 2 to 3 years worth of patient data, individual patients' data. We can analyze it. And we need all the data. We need the lab data. We need the medication data. We need their surgical, specialist visit, PCP visit, hospitalization. We need all the data. Once we have it, we can really look and analyze that data and figure out what are the existing chronic conditions, what is the treatment being given to those conditions, which is also known as a meet criteria. We can identify those. We can also look at what are the emerging conditions, what are the suspecting conditions, because these are the conditions which may not have been documented by the physician, but we found evidence in a lab report. We found evidence in medication. So we are able to connect all these dots using our large knowledge graphs and identify those and surface it at the point of care. So that is a prospective solution that we have. To give you an idea on how we have delivered the results, we find that a lot of providers are not well trained or even well up to date on the coding for ICD-10-CM, which is the chronic condition codes, because they are still used to coding for the CPT or the procedural codes, because they are still used to working under the fee-for-service models.
Right.
And so they are leaving a lot of codes out. They are forgetting, they don't know whether they can code or not. And so essentially they are leaving a lot of money on the table. And these numbers are too good. We have found one group of physicians, about 80 physicians, they were leaving around $70 million on the table.
Wow.
70 million. Now, a lot of it, their procedures may say, okay, it's not, they cannot bill for some reason or the other. They might have an agreement with their health plan, which might be different. If that's the case, even then, there's a substantial amount of money being left on the table.
Right.
So we can truly bring value to our providers as well.
Of course. Yeah. So it's a single platform for both the provider and the payer side of things, the prospective and the retrospective
True.
side of things.
True.
And you're really bridging the gap, or bridging at least, providers and payers on one platform.
Very true, Priya. And that is what our enterprise customers, who are large providers, who have both, they have a provider side of the business as well as the payer side, our health plan, they love our system.
Right.
Because when you implement it, there's one set of data that we collect for them. We do the prospective pre-visit coding for them. And once that is done, there is no need for them to do retrospective because it's accurate on the first pass. However, we might do some retrospective work for them because there may be additional data that may have come in from the patient having visited another physician outside their network. So we do it, but the volume of work gets limited. So imagine they don't have to worry about timely submissions to CMS because they are always on time. And we are doing things in near real time. So it saves them a lot of money, brings efficiency, ensures no money is left on the table, make sure they are compliant, and they are not stressed out. One of the terms I love to use in RAAPID is we care for our caregivers. And we coin it, are we caring for our caregivers? So caregivers are not only the providers, but the staff who works for them. And we truly make sure that we take stress out of their life.
That's amazing.
Thank you.
And truly making everyone happy.
True.
And speaking of happy news, congratulations for your recent capital raise with Microsoft.
M12, yes.
M12, yes.
Thank you so much. Yeah.
And why don't you share a little bit more about how this validation from a household name like Microsoft with M12 aligns with your vision for transforming risk adjustment technology?
Yeah. So taking a step back, I've never raised capital in my life. I've always bootstrapped my businesses. But I realized that to really grow substantially and scale my business, I needed to have amazing partners. And so when I decided that we are going to raise capital and bring in strategic partners, we were clear that we wanted to have an investor who came from tech world, an investor who came from the healthcare world. And I wanted both of them to be on my board. So we went out, and I think the first company I sent out to was Microsoft, and they loved us. I think M12 was looking for a great partner who had the right team, the right vision, who could disrupt the space and become a category leader. And they wanted a company which was really going to disrupt using AI. And this follows or aligns with their vision, Microsoft vision as well. Microsoft has made significant investments in healthcare. You are aware that they bought Nuance at $19 billion, which is now under the fold of Microsoft. So they are looking for companies which can truly make an impact. And when they went through their due diligence on our technology stack, it was tough. They wanted to know everything. They wanted to make sure that, because it being a technology and AI, top-notch AI company, they wanted to make sure that this purpose-built AI was not just vaporware. There was truth behind it. So it was a moment of pride for us, and also a lot of credibility that we are doing something right. I think Microsoft also brings a lot of other values, particularly in three areas in my eyes. With M12, M12 is a part of of Microsoft. So it's
Right.
not Microsoft has not directly invested. It's M12, their venture arm, and that is who invests on behalf of Microsoft. So one is the scale and security. We are on Azure. We are on Azure Government Cloud. We are cloud agnostic, but our home is Azure. And what we see is all the tools and infra that we need to scale our business is possible on M12. I'm sorry, on Azure. Just to give you an idea, we recently completed our scale up where we processed 50,000 pages in 1 hour.
Wow.
We now have the capability to process 1 million pages in 18 hours. So that is that at that scale we can operate. The second thing is security. We are a high trust SOC 2 HIPAA compliant company, all certifications. But Microsoft brings an added layer of security on our infra as well. So it brings trust to our partners and our customers. So that's one. Second, the prowess of AI at Microsoft is unparalleled. And we have been talking with them about their large language models. And now we have complete access to their language models as well as their resources and their research department. So that what we are doing to in our AI capability advancements will be augmented significantly because of Microsoft partnership. And the third thing is reach, scaling the business. 70% of healthcare businesses have something to do with Microsoft or Azure. And that gives us, because we will be on Microsoft Marketplace, Azure Marketplace, as a transactable solution. That means that we will have access to all their customers, will have opportunities to co-sell and co-market our product with Microsoft sales teams. So that will help us tremendously get the reach where on our own it was not possible. So amazing partnership. Very, very, very happy with this partnership.
Yeah, it's amazing news. And congratulations
Oh,
again.
thank you. And yes, money. They also gave us money, which is always important.
Of course. So how do you see M12 accelerating your growth for the next 1 to 2 years?
As I mentioned, one is the reach. Very, very important is a lot of health systems and health plans are on Azure. And typically for large enterprise customers of Microsoft, they have what is known as Azure credits. And if they buy our technology from their marketplace, it really helps them close those credits, use up those credits, and get deeper discounts. So they can really save a lot of money if they do that. That's number one, which will be helpful. Two, a lot of customers are very careful about data for the right reasons. This is healthcare data, PHI data. We have the technology where if they are on Azure or they have their own instance running on a cloud, not only Azure, this can be on AWS or GCP as well, but we can put our entire technology stack within their firewall on their infra. And what it means is now their data is not coming out at all. Their data remains behind their firewall, and we are processing it within their infrastructure. It brings a lot of confidence to the CIO, the CTO of organizations. So that will help us over the next 1 to 2 years. And the third thing is, I'm very, very excited because Microsoft has the talent, a lot of people, and now all doors are opening up for us to collaborate on research projects to advance AI. So we'll be accelerating our model development and improvements. So if this was on steroids, this will be kind of steroids on steroids.
That's exciting.
Yeah.
And I can't help but think about your customers too then. You mentioned you'll be on Azure as a transactable solution. So how does this help your enterprise customers?
Yes. As I mentioned, most of the Azure customers would be able to buy our solution directly from the marketplace, which utilizes their credits and gives them deeper discounts for Azure consumption. So that, and the transactable is very easy because now there is nothing to worry about the security or the infra. It's all behind their firewall. So it's a no-brainer now. And also, since we are not using our infrastructure or the data is not moving in and out, we can give the customers much deeper discounts because we don't have the infra cost or cost to manage their data.
So what's your vision for RAAPID moving forward?
For sure, RAAPID has to and will become the category leader in this space. We will grow exponentially. We will be launching much better models by the mid of this year. So that will further augment our customers' experience. Also, we are revamping our entire UI, bringing in most contemporary UI. So on all fronts, we are extremely customer focused. Longer term, RAAPID needs to be the de facto platform for risk adjustment. Particularly, we should start the work at the provider side, prospective coding, and make it autonomous. It is possible with the new models that I'm seeing and what my research team is telling me. It's just a matter of time. When we started, our accuracies were around 65, 66%. Now, out of the box, our accuracies are north of 80, 82%. We'll keep on working till it's north of 95, 98%. And it is possible. We are building a lot of agentic workflows now, leveraging large language models as well as Vision AI. So things are moving in the right direction. The ultimate goal in my eyes would be to have a single platform with autonomous coding for prospective, pre-visit, and completely eliminate the need of retrospective.
So it sounds like a very exciting future for RAAPID, which means a very exciting future for healthcare. And if our viewers want to keep up to date with all the innovations that RAAPID is launching in the next 1 to 2 years and beyond, and everything that you're doing as well in this space, what's the best way they can do that?
Oh, just follow us on LinkedIn or visit us at www.rapidinc, RAAPIDINC.com, or just email me, Chetan at rapidinc.com. My name is CHETAN. Thank you.
Thank you so much for joining us today, Chetan. And thank you to our viewers for signing on. And please do like, comment, and share. And yeah.
Thank you so much.
Thank you.
Dhanyavad.